Lung cancer. Overview, risk factors, and screening. The Canadian Task Force on Preventive Health Care is a group of experts who develop recommendations to either screen or not screen for specific diseases in primary care. Lung cancer is a disease that occurs when cells in the lung start to grow in an uncontrolled way. The cancer may begin in one or both lungs and could spread to other parts of the body. Lung cancer is one of the most common types of cancer diagnosed in Canada and is the leading cause of cancer-related death among Canadians. The chances of survival 5 years after diagnosis with advanced lung cancer are one of the lowest cancer survival rates in Canada. Lung cancer may not cause any symptoms during the early stages of the disease. By the time people start experiencing symptoms, the cancer is usually at an advanced stage and difficult to treat. Who is at risk for getting lung cancer? Smoking and age are the biggest risk factors for lung cancer. Almost all people who get lung cancer in Canada are over 50, and the disease becomes more common as people age. More than half of new cases of lung cancer are in people older than 70 years of age. Cigarette smoking is the main preventable cause of lung cancer, accounting for more than 80% of cases. Other causes include exposure to radon, secondhand smoke and other air pollutants, occupational exposures to smoke and asbestos, family history, and prior radiation to the chest. What does screening mean? When doctors screen for lung cancer, it means they are looking for lung cancer in people who don't show any signs or symptoms of having the disease. The idea behind screening is that if doctors can detect lung cancer when the disease is at an early stage, they may be able to treat the cancer earlier and thereby lengthen the person's life. Screening involves casting a wide net with an imperfect test to identify people who may have cancer. People with abnormal results will have to undergo extra, more invasive tests to determine if they actually have cancer. The test may also identify those with abnormal results who do not have cancer. The task force recommends screening for lung cancer only in people aged 55 to 74 years who have a history of heavy smoking and who are either current smokers or who quit within the last 15 years. Screening does not apply to people with a history of lung cancer or who are suspected of having lung cancer. That is because screening is done to detect people who have no indication that they may have cancer. People with a history of lung cancer or who have symptoms should be monitored closely by their doctor. If you have any questions, please consult your doctor. For more detailed information on the Canadian Task Force on Preventive Health Care Lung Cancer Screening Guideline and additional resources, please visit www.canadiantaskforce.ca.